right. Which of the following is most appropriate next step in management? All right. 45-year-old woman comes to clinic, 1 month history of difficulty turning her head to the left and pain in her neck, denies any recent trauma or history of neck surgery. Physical examination reveals weakness in her left sternocleidomastoid muscle and left trapezius, so cranial nerve 11. She has difficulty elevating her left shoulder against resistance, no other neurological deficits. Okay. What is the most appropriate next step? All we did was physical exam, right? Yeah. Okay. So I'm thinking a few different things. I'm thinking maybe like a radiculopathy, um, maybe some sort of like inflammation. I mean, I know like next step, I mean, some of these things I know you can do, like you could do a Botox injection. I know that's usually not like a first line thing. A cervical spine MRI, you'll get a really good image to see like, hey, what's going on. Refer for PT if it's, I mean, she has problem with like the certain mobility, certain movement. That's not like invasive. I think that's not a bad choice. The nerve conduction study, that's like a tougher study. Um, hmm. Something is telling me to do the cervical spine MRI,
Okay,
because it seems like that's the most appropriate like next step
sure.
to see, okay, let's get a better look of what's going on.
Okay.
And then after the fact, you would do physical therapy, you might do an injection, you might inject steroids there, you might that's if you couldn't find something, then you'd see, oh, do we have a nerve issue? So that's what I think cervical spine MRI would be first choice.
Actually,
Oh,
I
PT. Okay.
I let's kind of see kind of what they were trying to go for here.
Okay.
Yeah,
But
they
I
said
could see PT. I mean, it makes sense. Okay.
yeah, PT is okay, right? Says 1 month history of difficulty turning, right? Let's kind of talk about a couple things here. So they're saying that PT, okay.
Okay.
So difficulty turning head, pain of the left neck, weakness of this, difficult elevating shoulder resistance is diagnosed as torticollis, right? Um, I mean, abnormal head postures, etc. Right? It's kind of a strange presentation because torticollis, I mean, is not very common in adults, right? So,
Isn't torticollis like the neck is contorted a certain way and you can't like unstiff it? That's what I think of. Okay.
yeah, yeah, it is, and it's usually in kids because of the way they're born, right? That if
Okay.
you're in the womb and you're tilted like this, right, and you can't,
Okay.
you can't really untilt it, right, because of that side is kind of contracted more.
Okay.
So you don't really see torticollis too much in adults, maybe after trauma or something like that. So I don't know
Okay.
if this is, I'm gonna kind of talk about what I think about this problem. I don't
Okay.
100% agree with it. Actually, if it was me, I would probably order a cervical spine MRI just to see the soft tissue because on a
Right.
palpation standpoint, it's kind of depends on how big they are, like as a patient, right? How stiff
Right.
they are. You might be like, okay, that's weird, right? Like, why do you have trapezius? Why do you have, like you said, you're wondering
Right.
is 11 impinged somehow? Like, what's going
Yeah.
on?
Or is it like a disc? Is the disc herniated or something? That's what
Yeah.
I was thinking right away.
Yeah. So you can look everywhere along that, right? Whether it's the disc, whether there's nerve impingement, muscular, etc., right? Soft tissue wise. So actually I probably would have picked cervical spine MRI here because I want to get a
Okay.
better look. And then from there, if there's nothing, right, then
PT.
you rule out things like masses, lesions, cancers, things like that,
Right.
right? Anything very, very bad, then you can do the rest of the stuff. Then you're like comfortable as a physician saying, hey, I know there's nothing really bad there, right? But I would want some kind of imaging, whether it's CT or MRI, and then
Okay.
kind of then treatment. So I would probably say cervical spine MRI is probably better here.
Okay. Okay.
Okay, but yeah, the rest oral steroids, right, can be depending.
Sure. Makes
But yeah,
sense.
okay, and then yeah, steroids can be something that can help. Um,
Steroid, the Botox injection, or even the nerve. I mean, it's saying here nerve conduction studies like for peripheral, which I didn't know that. So that's like a good point too. I thought it would be for everything, but I guess you wouldn't do that for cervical stuff.
Okay. Yeah, yeah. So yeah, I mean, all these things are something that you can think of. But like I said, I would just want an image for this patient to make
Okay.
sure.